The worst has happened. Someone you love has suffered a transient ischemic attack or a mini stroke. Thankfully, you got to the hospital quickly and they're going to be fine. They are out of the woods. Unfortunately, not quite. Now there's another risk. A person who has suffered a TIA has twice the risk of suffering a heart attack than the average person.
So when we see somebody who's had a stroke, mini stroke, it's not just a warning sign for that particular stroke. It's a warning sign that something could be wrong in the general vascular system, that blood pressure's out of control, cholesterol's out of control, that nicotine from cigarettes has caused inflammation within the blood vessels. That inflammation may not be just limited to the blood vessels in the brain, but could very well be related to problems in the heart.
That's not the only danger. A stroke can set off a chain reaction that strains the heart. There are chemicals that reside only in the brain. These chemicals may be bad for the heart. A stroke can release those chemicals into the bloodstream, exposing the heart to their effects. A stroke may also damage the parts of the brain that control the heart. We know that damage in the right hemisphere increases the risk of serious heart rhythm problems and death from cardiac arrest.
So they're not two different entities. Sometimes the heart and the brain work hand in hand together in good health and in risk of disease.
Heart attack, congestive heart failure, abnormal heart rhythms such as atrial fibrillation, and cardiac arrest are much more likely to occur in the days immediately following a stroke. Recent recommendations suggest monitoring the heart of all hospitalized stroke victims for 1 to 3 days. A patient will likely be examined by both a neurologist and a cardiologist for any side effects.
So anybody that's had a stroke at some point, sometimes in the hospital, sometimes as an outpatient, will be seeing a cardiologist to make sure that since there is an increased cardiac risk in the future, to make sure that the heart's beating regularly, to make sure there's no evidence of hardening of the arteries that can go hand in hand with a stroke. And so it's a fairly routine recommendation as we're recovering from a stroke that at some point that there's a cardiac evaluation as well, either immediately in the hospital or in the near future as an outpatient.
That monitoring must continue even after the patient has returned home. In one study, 1/3 of patients who suffered a stroke experienced a serious cardiac event within the next 3 months. The average length of time between a patient's first TIA and a heart attack was 5 years. For patients who had a stroke before the age of 60, the cardiovascular risk is more significant, as much as 15 times higher than the risk of the general population.
So a young person over the years has not had enough years to build up what we call collateral blood vessels in the heart. Sometimes, if we're older and have had blockages for a long time, when we have a heart attack, the damage may actually be more limited because in the older person, the heart's had a chance to adapt to blockages that have very gradually developed, often over decades. A younger person who suddenly closes a blood vessel with little or no warning, the heart no chance to adapt to blockages developing, may be more severely damaged or stunned. With the increased damage that a younger person with a larger heart attack has, there'll be an increased risk of complications. And again, one of those complications can be the risk of a stroke, the risk of irregular heartbeats. And so I think the reasons we worry more about young people is because the body will have an ability to adapt to blockages that grow over many years, or blockages that suddenly develop. The heart doesn't have a chance to adapt to a gradual blockage, can be a more severe and risky situation.
The ability to anticipate and prevent a heart attack is a great opportunity, one that many don't get. A stroke patient may not be out of the woods, but we now have a map to guide them to safety, a map that includes medical treatment, continued monitoring, and implementing a heart-healthy lifestyle. I'm Dr. Allison Suarez, and you're watching the eHealth Network. See you next time.